You're watching BCTV, Branford's community access station.
This is BCTV, Branford Government Television, a service of Branford Community Television. The following program is brought to you through the support of the Town of Branford.
Long intro, my goodness. Okay, I want to welcome everybody tonight to the Elderly Services Commission. My name is Lori Rothwell. Will the other commissioners please introduce themselves?
Dana Murphy.
Jean Ricco.
Mary Hahn.
Pat Brownell.
Luba Miebert-Schmid.
Susan Barnes.
And I'm Dagmar Ridgway, Director of Newbrook.
And Doreen. All right, thank you. Welcome, everybody. Did everybody get a chance to review the minutes from our last meeting, March 8th? Any corrections, additions, deletions? Hearing none, do I hear a motion to approve them as written?
Second.
And second? Okay, so moved. Thank you. Dagmar, your report, please.
Yeah, any questions on the reports I sent you via email? And I also give you copies today on the financial and the stats.
I didn't have any questions.
Okay.
I'm just going to thank you, Dag.
All right. You want me to go ahead with my report?
Sure.
Okay. First of all, I want to say to everybody here and everybody at home, May is Older Americans Month, so we celebrate anybody over the age of 60 in our nation. We join with our colleagues across the country. We had a very nice lunch in which we've gone to annually yesterday at Oweniga. We had 104 people, I think, attend. So it was really very well attended. We had music. It was just a lovely day. And what we do also is every year at that event, we honor a remarkable senior in town. Last year it was Rita Santarosky, who has helped a lot with our genealogy. And this year, we as a staff decided that our volunteer instructors donate so much of their time and make so many additional classes possible. So far to date, just to date this year, 241 classes they have volunteered for, which saves us a lot of money and gives people a lot of opportunity for enrichment and lifelong learning. So I just want to recognize those people. Susan Craig, who teaches our Latin and French classes. Alana Keating, who teaches it's Qigong, it's a form of Tai Chi. I'm not sure I said that correctly. Lloyd Bazell, who does our Hot Topics group. Janice Samuel, I'm not sure on how to say that last name, who does our creative writing. Serial Volpata, who does Italian. Marty Garrett, who does our genealogy. Charlie Grabenstein, who does digital camera coaching. And Annette Rogers, who does our sing-alongs. And it also speaks to the abilities of our senior community and the resources they bring to our community, because these folks are terrific at what they do and they share with their peers. And it's really, we're very grateful for what they do, and we're glad to be able to honor them as our remarkable seniors, our instructor team this year. Along with Older Americans Month, an event that we have going on next week is our Shredded event. We do it twice a year. It's free to participants at Canoebrook. The bins are at the center. You can come over between 2 and 4, Monday through Friday next week, and bring your stuff in from your car. We unlock the bins, you toss it in, we lock it up, and then a week later, the shredded people come and haul away the locked bins and shred it. So it's a really good opportunity to kind of clear out the clutter, clear out things you don't need, and know that it'll safely be destroyed of, and it is free to participants.
Is there,
yeah.
Can other people use it, or just?
It's really for seniors, yeah. It's a benefit we like to give them. We like to do it in Older Americans Month. So, and I can't even tell you how many calls we've got. We've gotten a lot of calls from people like, is it time yet? I'm like, it's time. So you can do that next week. I wanted to follow up too on the plan of conservation and development that I reviewed with you last month, what I presented to the plan of conservation and development in February. I gave you a copy of that report. They still have not come out with the final draft of the report. I was told today that they're having a meeting June 13th here in this room to review the draft and to get public input. So if anybody's interested in attending that, it's June 13th. I have good news. I have lots of good news. I have good news on our 2019 budget. Tuesday night, the Board of Finance set the mill rate. It decreased 0.03%, and we did not have any cuts to our budget as presented. So we're grateful for that, and overall, I think my colleagues in town did well, so that we see a slight decrease in the mill rate this year, which is good news, in maintaining services. Let's see what else. Jamie's going to come. Hopefully he'll come and he'll give an update on the building, so I'll leave that for him. We've started another session of our Aging Mastery Program, and it's a little bit different in that we partnered. We're one of the sites that Anthem decided to partner with nationwide. There were 3 states, and Connecticut was one of them. So not only did we have the Branford Community Foundation who kicked it off last year and gave us funding so we can maintain it, now Anthem has kicked in to make sure it stays in for a while. So it's a pilot project, cooperative between all of us, National Council of Aging included as well. We sold out pretty immediately. We have 26 people. There were 4 on the Anthem side that didn't show up, and it was a free benefit for people who are Anthem participants. So we're excited about that, and it's really, we have some wonderful speakers, and it's a great program. Pat, we're doing it again.
Excellent.
Next time you're going to be a facilitator
I'm glad to hear
for
that you're
us.
doing it again. It was a great program.
Yeah, we're excited
Yeah.
that it sold out so quick, and being able to affect change in people's lives is a good thing. From the health department, there's some food code changes going on, because you may not realize out there that we have a restaurant license, and it'll be renewed in June, but all of us had to attend a meeting because there's changes in the state food code and the federal food code, and Nancy and I were qualified food operators. They just changed it to something food safety managers is what we're called. We just got recertified. We had to take a class, and we had to have a proctored exam. It's quite a deal. So we did that, and we got upped again for 5 years. So we're good on that. And the health department just happened to show up today and do an inspection during lunch, and we got 100 on our inspection, and that speaks to the team of people that we have in the kitchen. And that is Maureen Hall is our site manager, and she does a fabulous job ensuring the safety and all protocols are met. So I'm very happy about that. It's posted proudly on the wall. Pat, do you have anything to report on livable cities?
No, I don't. I just encouraged the community as well as the committee members last time to do some research on that site, because I think that there is such valuable information, not just for the committee, but for the people in our community to get together to form groups that we can work together with. I mean, definitely the development meeting that's coming up in June, one of the issues was the housing issue, and certainly with the projections of elderly coming up,
37% right now
30,
for our population.
right, coming up, that we need to do something. I should think we'd want to keep people to live in our community and not to have to move out because they can't find suitable housing and affordable housing as well. So I think that, that it speaks well that we get involved in doing something like this.
And I don't know
and working
Maureen,
together.
if the commission wants to spearhead a small group to work on livable cities over the summer.
Right.
I do know, I saw an email come through, and Pat, I don't know if you did, if you're on their email list, that there's a funding opportunity for municipalities to pursue livable city initiatives. I think it's mid-May is the deadline, though, so maybe not this year, but to watch it for the
Or next
following
Sure,
year.
next year.
Right.
Is something
Right.
maybe to work on, because I
Yeah.
think that designation allows you a lot of opportunities
Right.
for, make cities more livable for people of all ages. So I think that would be something to pursue. That's all I have on my report. I have information on social services. If anyone, does anyone have any questions on what I've spoken to so far?
No,
No? Okay, it's pretty good news so far.
that's great.
It's good news.
Nancy's off on a trip right now. They went to Pepe's Pizza and then to the Peabody, had a speaker, so They went over there, so she may or may not come. I don't think she'll be back in time to attend. But under social services, to date, we did the fuel assistance program ended the 15th. No, I think the 7th of May. And we did 650 total applications. 53 were denied or incomplete. So we had 597 applications were approved and processed. And there'll probably be some more that come through, some people who applied late. To date, $740,578 has gone back into the pockets. I imagine that'll be closer to $800,000 when all is said and done. We did 43 more applicants this year than last year, and the people in Middletown who we work with, Community Action Agency in Middletown, said that they did 20-something less than before. So I think people just stayed local and came to us instead of going there. We are ahead of schedule on the rent rebate thanks to the addition of the case manager, Janine, and they're just sending out, I think today or tomorrow, the letters for people who apply for the rental rebate program, which is once a year. I think it's 450, 475, somewhere in that ballpark. And now she is booked through August, and they start next week. So that's a busy schedule, but it's a wonderful program. And I have more good news on the state budget that was passed. The rent rebate program, they were going to make cuts to that program, and they did not. They restored all the funding to that program. And for those of you that we kept abreast of the Medicare savings programs, with all the outcry and all the active advocacy on the people of our communities, as well as my colleagues and myself, the Medicare savings program was restored and will remain as it was the current year. So people rest assured that will be, your benefits will continue. And also the elderly nutrition program that manages the congregate and home delivered meals, that was also funded. So we fared fairly well, and primarily because of advocacy and an election year. So that's the social service report.
Okay. Anything else?
The upcoming events, I think I mentioned the Shred It, and you have a copy of the newsletter there. There are a lot of trips. One of the ones that was a lot of fun that they just, was anybody here, did anybody go on the llama walk? Did you go on that? Nobody went on the llama walk? That was really interesting. We've done a lot of great stuff, and there's a lot of things coming up. And we're using, we're staying more local for some, so it keeps the cost down a little bit. So, yeah, that's all I got.
Okay. Well, thank you.
You're welcome.
So, well, until Jamie shows up, do we have any comments? I know, Dorothy, you handed this out. Do you want to talk about it?
Maybe have a little discussion about it.
Sure.
Do you want to
absolutely.
come up to the microphone, Dorothy, so they
Yes.
can hear you? And use the microphone.
And then we'll get to you.
We're here for the duration.
Okay.
It's a sit-in, Polly.
Though I had spoken to Mr. Cosgrove about the advantages of having enhanced hearing ability in the new senior center.
Okay.
And Dagmar, do you know
I-
if anything's been done about that?
He's told me, I followed up with him again about a month ago because I wanted to make sure it was in there, and he thought it was. He told me it was, so I'm just going with that. I will ask him again, but I did raise the
I'd
question
like
at
to
one of
give
our
you a
meetings.
copy of what I passed out to the commissioners. I had investigated the possibility of a enhanced sound, surround sound, and there's also available something,
The loop,
I beg your pardon?
the loop system.
I don't know what they call it. I'm trying to find my notes here. And oh, it's called the Oval Window Audio Inclusion Loop. You're right.
The loop.
The loop system.
Yeah, that's the one that's most commonly used.
And, besides myself, I wear 2 hearing aids, as you know. And there are many of the seniors who don't admit to not hearing, but do. And I think it would be of such benefit to add that to the building of this facility. And I think that's item number 2. So going back to item number 1, I know that there's a great deal of information from the political registering for voting. But I think it might be helpful to the seniors if they had a resource. And so I thought it might be a good idea to have the registrar of voters from both parties to present the topic of what's available to them through the registrars, how they can get to vote, the transportation, and all of the little surrounding necessities that come with voting. So that was one of my suggestions.
Okay.
I ended it with another last thought, in the hopes that this commission would reach out to other boards, other commissions. I don't know what the Human Services Board is
The
involved.
Counseling Center. It's the board for the Counseling Center, the Branford Counseling
The
Center.
Branford Counseling Center. I don't know if there could be an interworking of whatever that presents, but it might be something to investigate. If you have any thoughts about the advantages that could be included in the new senior center, and by all means the housing, which seems to be in a state of indecision at this moment. And I ended with, I realized that you passed out information about the AARP at the last meeting, that they have programs for seniors. And my last comment is, but there's nothing like the hometown team. And if you could indicate to our citizens, our senior citizens, the advantages of this committee and other committees concerned, it would be very helpful. Thank you for your service, too.
All right.
I think it's a dedication when you volunteer something like this.
Okay. Well, thank you.
Dorothy, did you want to share anything else with them?
Thank you, Dorothy. Thank
You're
you for
welcome.
sharing.
Thank you for having me out.
Okay. And now we have other ladies. Would you like to come up and please introduce yourselves?
I'm Cynthia Feldman, resident of
mic.
Branford.
Use the mic.
Oh,
Thank you.
Cynthia Feldman, resident of Branford.
Hi, Polly Fitz, resident of Branford. And we're here today to, we're looking for some help in clarifying the present and future resources for seniors who are Branford residents in the area of transportation. We see, as you do, the increase in our aging population, and we have some problems with transportation as it is in Connecticut, and it seems plausible that there will be definitely an increase in the need for transportation. What we've done, and it's very preliminary, but we did want to collect some information before we began to talk to people. And ours is an interest. I was a volunteer for East Shore Health Department's driving program for 13 years, so that's my background. Cynthia's been in social services and mental health services, so we bring our biases as well as our ideas to you based on them.
Yeah, okay. Go ahead.
Our information comes from people that we've talked to who cannot be served with current resources for reasons of disability. And I've already explained information I have came from the years that I worked in a volunteer driving program which was somewhat different than the senior centers program in the way it was structured. It was also a regional program. It was East Haven, Branford, North Branford, and Northford were included. And then we've started a review of transportation information that's available online, directly from agencies, and we've got much more to review, especially online right now. And there seem to be some regional programs emerging in Connecticut online, which is very good to see. So I'll turn it over. Cynthia's going to talk about some of our preliminary impressions. As I said, we've talked to a lot of people. People have approached us about problems. And then we've started to go to talk to the professionals that handle transportation programs.
As we searched for information, this is just part of the packets of stuff we gathered from the computer, we found out there are many resources for transportation, but they're mostly for residents of facilities or people who are members of senior centers. So that leaves out a bunch of people. The resource lists, they do define eligibility. They also define limitations, such as a driver cannot assist a person on and off the transport. Sometimes they don't accept wheelchairs. Some aren't able to handle rollators. Walkers didn't seem to be clearly addressed in most of the information I read. And there are many limitations, that not just for seniors, but for the physically challenged. Most of our information was secured from Canoe Brook and the Agency on the Aging South Central Region and online. And also, the format of the information varies depending upon the resource. So it's hard to plow through it. There's not consistency. Not all of the information is user-friendly. Some people don't have computers. They're not going to be able to access it, and how do they call? Who do they call? It needs to be more user-friendly for people who are needing services and also for the families who are helping. For example, I didn't know, and I think I'm correct in saying this, that My Ride, Greater New Haven Transit, and Dial-A-Ride is all the same. Is that accurate?
Greater New Haven Transit and what else?
My Ride and Dial-A-Ride, that's all the same.
Dial-A-Ride is a term that's used for paratransit.
But it's to access Greater New Haven.
It's not just Greater New Haven, but like many communities refer to their senior transportation as Dial-A-Ride. You're right, there's not consistency in the terminology and how it's used.
It's rather confusing,
that's very
right?
true.
Yeah. We ended up with a lot of questions, and we thought the general public would probably have more questions also. I think I said that some of our information came from people, and I think Polly said this too, that have not been able to use the services for a variety of reasons. Not being able to take the step up onto the minibus, not being fearful of the stool that's at the bottom to step up to the first step, and so on. Let's see. We didn't find much evidence of transportation services being shared between agencies. Maybe Orchard House, but there are a lot of minivans sitting in parking lots where they serve the agency, and they're sitting there during the mid part of the day, and they're not being used mid portion of the day. And probably this could be worked out it's complicated, and it involves insurance. As Polly said, I think you said the East Shore Health Department program that serviced 5 towns has not been replaced. So that was a regional effort. There are many people, we think, that fall through the cracks for a variety of reasons. I have some particular stories about people that I've known who have not use the services for a variety of reasons, their own reasons, but also health reasons. We do have the impression that the regional programs might have some excellent potential. Sharing of buses and financial information. There's much more. Is that what you're saying? I'm getting to your part.
Oh, that's okay.
Okay. I think that's, let me see, I don't think I have anything more. Nope.
I think, lastly, it's clear to us there needs to be a lot more assessment, but it seems to us also that some work could be started on interagency processes, regional processes, however you want to say that, and as well some assessments, as well as we're talking to people individually, and you certainly need more numbers to have a better idea, and probably some real formalized assessment needs to be done. But we do have a concern about the people who really have the problems. In the East Shore Health Department program, we went to the person's house, we helped people with wheelchairs, as long as there was, they had one that we could fold up. We stayed with them during their appointments, and then we took them home. So there was no problem with people with wheelchairs in that particular program, in the time that I served in it. And so those are the folks that seem to be saying we need some more help in the areas. And I don't know how many people in wheelchairs, the senior center, from the material, it seems as that's a limitation.
It is, and I can, if you want me to speak to that, I certainly
Absolutely.
can. It is on many levels. And when did you work with Jane Hannigan?
Yes.
She was a wonderful person, and I think Lori through the VNA.
I used to call her all the time through the VNA.
We would refer there all the time as well. I'm glad to hear you say you want it regionalized. It's difficult in shoreline communities or communities to get them to regionalize because of funding, because of miles. To get from one side of town in Branford to the other is a time and a mileage thing. And historically, whether it's transportation, food, whatever it might be, New England communities are not county-based. Everything's funded regionally, and it creates a challenge. But there may be funding federally that you can work with on that through the DOT. There are different levels of care that people need. And we at the Senior Center, our particular niche is independent-oriented people. And that's who comes to the center. It doesn't mean you can't be in a wheelchair. People are in wheelchair. They do use the My Ride. My Ride does about 800 rides a month in Branford, part through the regional rides program that has extended hours and extended service area. But the regional ride program, we get money from the state and the town turns it back over to the transit district. Some of the communities like Guilford and Madison do not participate in regional rides. So they don't. In addition, the town pays about $8,000 a year as a membership fee to Greater New Haven Transit for the My Ride, which is wonderful. And our transportation, our medical transportation, part of the reason we don't do hands-on is that's all volunteer-based as well. And we need to protect the volunteers.
You're talking about the cars?
The cars, yeah. We've got 3 cars. And we're very fortunate that the town funds the cars, because at East Shore, I think you used your own vehicles.
We used our own cars.
And the environment's changed in the last 20 years. The environment, the delivery of services has really changed great a bit. It's expanded. But we do around 4,000 to 5,000 medical rides a year and 6 to 7 bus transportation a year. And we focus on the buses, transportation to the center, grocery shopping, and activities that we do. And then the medical cars do the medical transport. And we have a responsibility, even through the insurers, we have to assess everyone who uses our services to make sure they're appropriate. They can have walkers, and the drivers can put the walkers in, but we do have no hands-on. They've got to make sure that from their house to the vehicle, we're curb to curb, from the house to the vehicle is clear, particularly with ice and snow, so they're not at risk. There are challenges with expanding that. by participating in the My Ride, and people have this vision that My Ride was like it was 3 or 4 or 5 years ago, and I'm on the board of the Transit District, Greater New Haven, and they have a new director. They put in some real initiatives to expand what they're able to offer. They now have a fleet of, I think it's 73 vehicles, I'm not sure, I don't remember from our last meeting. They provide transportation. The whole way they came about is with federal funding, the transportation, the fixed route. It takes more time to transport someone who needs assistance for whatever their disability is, not just wheelchair. There are other people with respiratory, whatever it may be, who need assistance. Recognizing that they could not use a fixed transit and keep that transit route on time, the federal government put money in, created the transit districts, and said, you've got to do these paratransit dial-a-ride programs to get people who need hands-on assistance to their appointments or whatever it may be. The Regional Rides program is an expansion of that. It's state money that goes in that expands the hours, that expands where they go and who they serve. And that takes people to dialysis, to work, and I forgot where the other one was, maybe grocery shop, to medical appointments. So that's what Regional Rides does.
Can those people be assisted?
They are assisted within limits. Like, they can be in a wheelchair. People who come to our center use My Ride quite frequently if they have wheelchair. I have one guy who is in a wheelchair who, I asked him yesterday how he manages to do it, and he has a big limousine, and he figured it out. He does it. He had an injury from an accident. I do know, being on the board of Greater New Haven Transit, they have great problems with injury to drivers and people actually pushing. And years ago, I had a transportation coordinator who was pushing a wheelchair, which now can be very, very heavy, and you put a 200-300 pound person in it, it's even more heavy, and he injured his shoulder. He was out for 4 months. So not only did we not have a transportation coordinator, he needed surgery, he was out on workman's comp. So the town has a responsibility, and through OSHA, to protect our employees. So we can't lift over a certain amount, we can't provide hands-on assistance, which I understand is a problem, but there are programs that do help people through the transit district, through the Interfaith Volunteer Caregivers. Shoreline Village is another resource, but you have to pay into that. And I don't know if many people are aware that if you're designated ADA, Americans with Disability Act, through the transit district, you can take, you've seen those metro taxis around that are handicap accessible?
Right.
You can take those at half off. You get a voucher and do that for half off.
Training for the drivers of the Greater New Haven Transit?
They are specially trained. They have to get a certain certification. They have a certain certification. They have specific training. They take good care of their drivers, but they still get injured.
Yes.
And so it's a problem for them, but they are designated by the federal government and the state government as the ones that have to maintain that and provide the services to people.
So in your view,
Yeah.
excuse me, in your view, are the transportation needs, you feel that they're being met then? I'm hearing you say that the transportation needs are met, or the services, at least the services are available. Maybe your view is people don't take advantage of them?
I think we can do a better job of getting them information out. Sure, there are gaps. There are people that fall, and as a municipality or a government agency like the transit district, they're not there to replace the function of a family. We're a municipality, so there are limits to what we can do. Can we explore and see what else there is? And I liked your idea of, there are places like the daycare center that services a population that probably, I don't know, I haven't spoken to Stephanie about it, that need hands-on assistance, and people of all ages, and their vehicles are pretty much, they get the people there and then they're used in the afternoon. That might be an opportunity to explore with other daycares, not just that one. Maybe their state association has places that do that, but I'm assuming their drivers are trained.
Yes, they are.
In that.
Yeah.
And they also, our drivers are paid nominal fees, and years ago, the commission actually put in place that we were to try and hire senior citizens in positions, particularly in our part-time positions, which we do. All of our drivers are seniors, because I think it says to the community, we respect our seniors and they still can be a viable part of contributing. And they are all CDL drivers, so we put them through that, so they have the CDL training, but not the other. And
So the Elderly Commission then's view would be programs related to the senior center, not beyond
if they can go larger, they can certainly, the commission is for on every level. And I do know it's been a challenge for some of the assisted living places. Occasionally, they do call us and say, can you take our people? And we take people if they meet our criteria, and it's not like if someone has a doctor's appointment, their bus only goes on Thursdays to medical appointments, and their doctor only sees people on Tuesdays, and they're appropriate, and we do an assessment, we will take them, but we're not to replace. In our procedures and policies, it says when no other means of transport is available, particularly because when assisted living started to come out, historically, they would have people pay in their rent for transportation as a service they offered, and then they didn't want to do it. And that's a service people are paying for, and so as a community, as a senior center, we don't try to replicate what they do and try to enforce that is a benefit of someone moving into assisted living. So we couldn't possibly do, like Greater New Haven Transit does, 700-800 rides a month in Branford. We couldn't possibly do that. We don't have the resources to do it, or the training, and that's not our population. Whereas I do think, I really like your idea of, the adult daycare is regional, and it may be a good fit for them. I don't know if they can get funding to do it, and that would help them.
It's been explored, and it's very expensive. The cost would have to be covered. So those funds would have to come from somewhere, and that's where the exploration would probably take place.
The transit district has to do, what do you think it costs to do one way of someone who needs more assistance? The cost. It's $45 to $50 each way. So it's, $80 to $100 per ride. So transportation, the other challenge is financing it. It's really, I admire you for bringing it here and starting the discussion, and the hard part's going to be trying to find funding and liability. Those are your two biggest issues. It's hard. It's a challenge.
So much. What happened to East Shore? Why was
they
that
lost the state grant. The state money ran out. So I think there were 20 of us at the time that drove, because we delivered a lot of service.
You
did.
That's
And
great. So I wonder if there's opportunities, if there's other grants that could be pursued.
I don't. We haven't talked to anybody at East Shore.
Yeah.
I'd like to go back there and talk to them, because it's been a long time since that program has not been
Absolutely.
operating.
Holly, when you volunteered,
Yes, I was a volunteer driver.
but did you get refunded for your gas money, or?
We could, half of us didn't take the money,
Sure.
but they offered that we could get reimbursement for our gas. What I remember from talking to Jane Hannigan is that a lot of the money from that grant went to cover insurance because of the
that's the
liability.
issue.
They had a blanket policy, as I recall, that covered anyone who used their own car. That's where I'm going in my head, that I remember. It was, and the landscape of transportation has changed so much. You didn't have the transit district. You didn't have us doing medical to the extent that we do now. You didn't have Uber. You didn't have the Metro taxi program. There are resources, but how do we regionalize and how do we connect people?
Well, Uber had a demonstration program for seniors, and they were working because there was some in the beginning some problems with people learning how to use the app. But so they did a demonstration project. I don't know, you probably might know what happened to it, but it was very successful, and I don't know if it was a reduced rate. That was my impression. But That
Yeah.
was a very good program. The problem is that we're also trying to bring to the table is how do people get this information? We've been spending a lot of time online, and we're talking to people, and as well people coming to us. And it just seems to me that's a problem. If all these other problems can't be solved, then that's an immediate problem that could be solved, is to get some clarity in that information, have it look alike. I just think that would be a wonderful first step.
Is it worthwhile to get a meeting of these, a representative of these various groups, so that there's,
Like an
get a
expert?
consensus of opinion
Sure.
on how to go about it? But I agree, I think a huge problem is publicizing it and getting it to the senior community that needs it.
There's also, have you heard of GoGo Grandparent? GoGo Grandparent, and I'm not sure if they partner with Uber or Lyft, one of those two, recognizing that a lot of seniors, not a lot, because more and more are very computer savvy and use their phones and use apps, but recognize there is a segment of the population that is not. And so GoGo Grandparent, you sign your parent up for it, or your friend, or yourself, and they will, you just call them, the 800 number, they will book your Uber or your Lyft for you. They will send a notification to a family member, can track where you are. If there's some memory status issues, they'll track where you are, that you're at your doctor, you got home, they send texts, they do all that. They charge a fee for it. The best thing I've heard is the New Freedom Fund taxi voucher program, because that's for people who, they have the wheelchair, they don't have to have a wheelchair. It's a private taxi at half the cost, which is a wonderful thing, but a lot of people don't know about it.
So how do you get that information out to people? I think that's what this.
Yeah, it's not our program, but the transit district certainly manages it, along with the Metro taxi.
How do we know that?
I think we could do
Somebody
a,
in the senior center doesn't.
well, Gina, it's in our transportation brochure.
May I say also that in one of my comments here, I felt there should be more media
Yeah.
response and information to the media, even though that people watch television, they still read.
What I think would be a great idea is, I can work with you on it, working with Kim Dunham, who is the executive director of the transit district, who they may even have marketing money. And they need to hear that people don't know what's out there. And she is a smart, savvy woman. She was up at the Greater Hartford Transit District. She's all about servicing the people and getting the message out there. I think they do have a marketing person on their team, and I'd be happy to work with you to set up a meeting with her. I don't even have to be there. If you prefer, I don't. But I think that is an excellent contact to start to pull it together. And I do think on every level, we as a senior center can do more in marketing. Unfortunately, we don't get a budget for it, and I'm not a marketing. We do the best we can with what we have, but you never know. Somewhere out there may be a retired marketing executive who's willing to step to the plate and help us. And using social media is, people more and more do it. The transit district now has an app that you can just put on your phone, book your rides, cancel your rides, change it, whatever. So they're doing that because more and more people are using it. But I think you start with the transit district, who is designated and regional.
Well, I think it would be helpful to have you at the meeting and provide entree for us.
Absolutely.
Because we're trying to decide in terms of our time, and our interest is certainly there, where to go next. But I want to get back to what Susan's talking about, getting agencies together. And it seemed to me there was a group of all the different agencies
Years
that
ago.
had a coalition that met,
consortium.
almost like a professional group.
That's how we got the adult daycare started. Remember, it was at the VNA when it was on Kirkham Street, and we had a meeting saying people need help when they have some dementia, mental status, things going on, and that was the birth of the adult daycare, and we hired Tom Romano and got funding, and it was timely. I think
But this is a cross-section of people who work
We
in...
were part of that committee. It was called the consortium.
Oh, okay.
And there were we had everybody.
Everybody.
Yeah, Dag, you were there. I was there from the VNA. And we would
Police,
discuss
fire.
particular problems that we would have in town. I'm just curious, if you call 211, do they provide you with transportation information?
Yep.
I mean, another very valuable resource
That's
is for
right.
anybody just to call 211. Local shelters, in emergency, transportation. I haven't called it for transportation information.
have it.
But it's a thought.
And you
It's a
can get
thought.
data online at their website too. You can
Oh,
download
there's
data.
amazing,
It's great.
yeah, we've been online.
Oh, yes.
It's wading through, and the
It's
inconsistencies
hard.
that
It's all
Cynthia
different-
raised
it's
is
all different
really
formats.
tough. It
There-
is. The formats
It's
are
like
so
a puzzle
different.
to get through it.
Didn't in the budget, the monies that had been planned to be taken away for funding for senior projects, I think that had been put back in.
Which budget? State, federal,
The
local?
State budget.
Yeah, that's what I talked about earlier, that all those programs were reinstated, the Medicare
Yes.
Savings Plan, those programs, they did reinstate
Would
the
something
funding.
like this not come under that?
This is more through Department of Transportation. I would think what you're talking to is an organization across all disciplines. We're pretty good locally in terms of communicating with our colleagues in Branford. It's so darn territorial in Connecticut. And for example, I have a professional organization of all senior center directors. And Laura, you probably have one of the VNAs. I don't know of a cross-section. I do know the DOT does sponsor forums on transportation, and Kimberly Dunham can certainly help you with a contact there because she works very closely on funding for the district and would also know where the federal and state money is. That I think is your key person in trying to
Well,
get
the
more
other thing
regional.
is maybe the Branford Community Foundation would help with getting the people together, sponsoring just a day-long thing where the people from different agencies could get together as a beginning to dealing
I
with.
think the discussion's worth it because I learn ideas from other places. I think the funding would have to be regional.
Yeah.
And
I
you
agree.
know, if we pay money per capita to the transit district for everyone in Branford, but Guilford doesn't and Madison doesn't, then they're not going to want to participate. You know what I mean? And it's hard to, every town is so unique and every leadership is different. You know where else would be a great resource? Not only the transit district, the Connecticut Conference of Municipalities, CCM. And every town belongs to that in the city. And that, they do have a transportation specialist there. I think it might be Steve Dudley, who used to work for the town. I'm not sure if he does, I think Steve Dudley does transportation, but Connecticut Conference of Municipalities.
I mean, it is regional. There is a 9-town transit
That's the
regional
estuary.
service, estuary. We thought we might learn something from them.
They don't each have their own bus, they service a whole
Yes, a
regional
whole
area.
area. And
Yep.
they've managed to expand also. So,
Yeah,
So-
you've got some great resources.
So
Well,
what would
we
be the
thank
most
you.
helpful?
Yes.
What would be, it sounds to me like, that there are opportunities, but it sounds like people need to know, what's available to them. So I think maybe we have to figure out how we could do it. If it could be posted on the website. I mean, what would be the
Some
most
people don't-
helpful?
some people don't have computers.
website?
It
should be on the
is,
town's
we do
website.
have, you have the brochure that we have
This is a
that's,
great brochure.
it's,
is.
we put that at Town Hall, we put it at the Senior Center, it's online. But again, until you really need transportation, you don't know about it. And
Sure.
very often it's family members calling us and we give it to them. And I do have a transportation coordinator, Gina, who used to work in Madison. So she's well-versed in what's down the shoreline a little bit. I mean, whatever we can do to facilitate and help you, we're willing to do that. Whatever we can do, just let
And
us
one of
know.
the newsletters, even if it's once a year, there could be a listing of all the
Sure.
advantages that the senior center can advance.
Yeah,
And
we can,
people would learn in that sense too.
yeah, it's, when they need it, they call, and then we do it case by case, but I do think it's a marketing challenge, and we can do better, for sure.
Well, at least once a year, we get something from the transfer station when it's going to be open. What would a mailing for how many people did
We
you say?
looked into that, it was about $1,200.
To mail to everyone, that would be, well, that's not prohibitive, is it?
That's just for the mailing.
That's just for the mailing, but the printing
Just for
and
the
the,
postage, yeah, that doesn't include the printing.
Are you saying once a year, to it's $1,200 to do that once a year to put out, to bill it?
each time you do it, and it's per household, they charge you. And it's whether it's color or not color, it's, I don't,
Black and white.
I'm not, I think if there's someone out in TV world that's interested in working on marketing or on the commission, again, we could use the help in that area. The town, I wish the town had a marketing specialist, we don't. And we're trying, I do know they're trying to boost their Facebook participation and post more things. The person who does it best in town is the animal shelter. I think she's got 17,000 followers or something. She's got a tremendous amount, so Laura knows how to do it well. It's worth asking her, how do you do that?
Well, then what you're saying actually is that we should have a committee, possibly. The RTM is divided into committees to investigate different subjects that come up. Is that something that could be arranged in your committee? A couple of people to investigate one segment of the questions that are out there?
At our last department head meeting, it came up because they were trying to promote social media, et cetera, and we made the suggestion to Jamie to hire a media specialist for there's 25 departments in town, and we all, unless you come to us, you don't really necessarily know what we're doing until you have a need. And so we did make that suggestion that whether it's an employee, a volunteer, an RTM or whatever, that they do have someone responsible for a media specialist who makes sure posts are current, who makes sure the information's there. 211, and it did come up, Trinity Church tried to have a program where they would get services and information out to people, and part of it is it changes so much at who maintains it. And 211, we didn't want to duplicate what they do because they do it well if you pick up the phone and call them. They are really on top of it regionally, but the real bigger issue that I hear you saying, Polly, is can we work together on the nuts and bolts of service delivery?
Well, and at least try it with the first step of beginning to look at distribution, hitting the people that need it. It's very interesting to me. I've done research, and this was worse than collecting data for any research project I ever did.
It's not easy, getting old and
because of the way it's presented. So I can just imagine a family, they have a need. They're going to start looking at the information. You're not at your best, and it needs to be at least somewhat consistent so you understand. You might not even know what a rollator is.
I do.
No, not
but
you.
other people
Not you,
may
but,
not.
No, but the families. I'm talking about the families when a crisis comes through. There's so many things they have to do. Anyway, listen, we thank you for your time.
Thank you so much, ladies. I know transportation has always been a huge issue. Something that's
We couldn't
really
agree more.
desperately needed. We need East Shore Health Department back again.
Well, maybe they will. Maybe Michael will jump on
There
board.
you
But
go.
again, it's a insurance liability.
I
There's
know.
the scope has changed, and you want to work with what's there.
We'll be talking to more people, and if it'll be useful, we'll certainly want to share anything we find out with the commission. But we will be continuing our information gathering.
Okay, thank
If
you
I
so
can
much
help
for your
with, be in
information,
touch with you,
ladies.
Polly.
Thank
It was
you.
very helpful.
Thank you.
Okay. Are there any other comments? Anybody else? Any citizens with comments? There was just one thing that was in the suggestion box. Adventures abound with things that are being offered through the East Haven Senior Center. Again, anybody, it's right here.
Is it travel?
It's a whole bunch of things.
Okay.
It's a lot of this stuff
Where was it, in New Haven Register?
You don't.
I don't know. It's a clipping. It's clipping.
Do you know who submitted it? Is their name on there?
No, it's just here, so I
That's hard,
don't
so we
know who
can't follow up.
submitted
I'll be
it.
happy to look
But there are
at it.
different things, and Dag, I'll give this to
Okay.
you, so we can look at it. But thank you so much, ladies. I don't think that Jamie's coming.
Oh, okay. I forgot about that. The building update, yeah,
Oh, thank you.
I know he had another commitment he was going to try, but he didn't. We continue to meet weekly on the building. You don't see much exterior-wise, but all the pilings are now poured. The inside, they're actually framing walls are framed in. They're working on plumbing, they're working on lighting. A lot of the work has been infrastructure, like sewage pipes that totally needed to be replaced, which is a significant project. We're working now on the fit and finish with designers and trying to trim that down because of budget constraints. And they are running, last I knew, 38 days behind. And the new date for completion is December 26th, I think, per the contract, which means probably we would move in January, depending upon how things go. But they're ordering brick, they're ordering all kinds of things, and we do meet regularly. And they face some challenges with the infrastructure, and they can't go up with the new part until all the pilings are in and the sewer pipes are in, and it's 50 years old, so some of the pipes, when they did the camera through it, had some corrosion and some issues. So I got to say that the team of people, the builder, Secondino, and Jamie are working very hard to get things accomplished. It's a very ambitious project, and a lot of our time is going into it, but it's exciting.
What seems to be the delay? According to a report that I've read, there seems to be a delay with the building committee.
The permit was issued. It was with the building permits being issued,
Yes.
and they have been issued. There was a delay in that, for example, all the environmental testing, and they have to meet all these specifications, and there's a company that does. It's been quite a learning process for me. My eyes have been open. There's so much that goes on before you even can build up. So it was primarily getting the building permit, because all the testing and all the special things, if you get one thing done, then they'd require another, a punch list of another 20 things. But I am pleased. I think about 2 weeks ago, they did get a building permit, so now everything can fly. And as soon as people see the exterior walls go up, they'll say, wow, they're doing something. But trust me, they've done a lot. You wouldn't recognize the inside. It's completely done. There's drainage, there's all kinds of stuff that they're addressing. So that'll last another 50 years.
That's great. Okay.
Discussion today, ladies.
No, thank you very much. Thank you. All right, with that said, if there's no other comments, do I hear a motion to adjourn?
Motion to adjourn.
Second.
All those in favor?
Thank you, everyone.
Thank you so much. And Commissioners, I
Oh,
just
Lori,
have
what
one
about
thing.
next month?
Yeah, next month, just so you know, I will not be available on June 14th, so I don't know if you want to hold the meeting without me, or if you want to cancel it and we'll move on. We've had plenty of meetings this year, but I don't know what your feelings and thoughts are.
We wouldn't meet until what?
September.
September.
Do we have enough?
You can always call a special meeting if you need.
June 14th before the summer is over, because the temperature's a long time away, and things come up.
Do you want to change the date, or is that not going to?
If you change the date, then it's a special meeting, but
It's a
you
special
can.
meeting.
Play it by ear?
You want to play
Why
it by
don't play
ear?
it by ear?
It's up to you. Okay.
All righty, so we'll play it by
If
ear.
something comes up with the building or services, et cetera, or meetings, then we just meet.
That's up to you.
Taking off, but I have a fundraiser.
Okay. Oh,
Okay, bye.
Easy, good to see you. All right, thank you so much. Yeah, that was it. So that was the only thing that I wanted.
The preceding program was brought to you through the support of the Town of Branford. Watch town meetings or other videos on demand at BranfordTV.org.